Look, we've had 4 referenda to have to coincide with the elections of the Senate and the House of Representatives on the one day, which we do anyway. They've been rejected 4 times by the voters. The difficulty is if you've got an opposition opposing a referendum, and or a state or two opposing a referendum, it's extraordinarily difficult to get through. Now, it's going to be very difficult. There may be an alternative. It may be that there's enough power already in the Commonwealth to be able to get legislation through that's appropriate, even if the states don't particularly like it. But you could only do that on the basis that the coalition went along with it. If there was a consensus on it, then it would pass both houses, and there may be legislation that the High Court would tick off on.
Well, look, then read it for us politically if you can, because you're quite right. I mean, it seems almost illogical to say we'll have a referendum on it when no referenda has really, I think only one of them's got up before, but when you've got the states opposing you as they are, he must have an end game involved, the Prime Minister. Is it a big bucket of money that you give to the states? Is that where it's all going to end?
Well, there's already a big bucket of money. That's the money collected through GST.
No, I meant an extra bit of money to try and to make this argument go away.
Well, then you've got to face up to the issue which Nicola Roxon actually foreshadowed, to say, well, we may have to look at general tax levels. Because if you want to have every state in the Commonwealth having the same kind of level of health care that they have in Victoria, then additional costs have got to come from somewhere. And that can only be done by being spread right across the board. But I think that what it reflects is that the Prime Minister is ambitious to set a national agenda and to get that national agenda running.